Hello everybody and welcome to October's Team Brief. Just a few quick messages from me before we get into the detail of the session. So first of all, could I ask you all to remember to complete your staff survey and also to remind members of your team. Completing your staff survey is a really important opportunity for you to give feedback in detail. Now, I know you're all completing the staff, friends and family test every quarter, and that's really important. But the detail we get from the staff survey is really helpful to us in attending to the things that you feel need improvement. So please make sure you do that. Secondly, can I ask you all to ensure that you get your flu jab for those of you for whom it's appropriate to do so. Occupational health are running special sessions, so you should be able to get along and get that done. Really important so that we can all remain as fit and well through the winter as we can in order to be here to look after our patients, and also for you all to be fit and well so that you can enjoy the time when you're not at work with your family and friends. Now, I know the hospitals continue to be really busy, and I just wanted to, thank you all for the work that you're doing every day, responding to those pressures, working with your teams to ensure that our patients remain safe and get really good quality care. Despite the pressure we're under, we're still getting wonderful feedback from our patients, and I just really wanted to say thank you to you all. Now, you will want to know that I'm just as busy as you are in responding to those challenges, and I absolutely am, working with other members of the leadership team here within the Trust, but importantly working with colleagues across the system, with colleagues in Virgin Care, with our North West Surrey commissioning colleagues, primary care colleagues and with adult social care. And some of you will know there is now a team operating in the hospital comprised of all of those partners in the system, helping us move patients through their pathways of care and importantly discharge them safely as soon as possible. We know that flowing patients through the hospital enables us to respond to the peaks in demand that we experience and to have the right bed in the right place available for our patients. We're also doing work to look at the medical model, particularly around the assessment areas, so that's the medical assessment unit and the medical short stay unit, and just working out where it's best to place those facilities and how best to resource them in terms of clinical support and leadership to provide continuity of care, but also nursing support and therapy support so that we can be as efficient as possible in order to help patients move through the accident and emergency department into the hospital and hopefully onward home to a safe and sustained recovery. So please be reassured, we are working really hard with those system colleagues to respond to the challenges in our system. We know the winter's coming. For many of you it feels like it's already here, and we do recognise that challenge that and the weight of responsibility that it places on us all. So thank you again.
Today at Team Brief, we spoke about the Manchester Patient Safety Framework. It's a tool used by NHS organisations to assess where they are with their safety culture. It focuses on 10 dimensions of patient safety and asks teams around the organisation to gauge how mature the culture is in their areas in relation to those 10 dimensions. For example, things like, are we good at reporting incidents and learning from incidents? Over the last few months, the 4 divisions across the Trust have been using the tool to assess their own safety culture, both in teams and in specialties. And today, diagnostics, therapies, trauma and orthopaedics and women's health and paediatric divisions fed back their findings and where they feel they are with their patient safety culture. The other 2 divisions will feed back at next month's team briefing, and then we'll move forward with the actions that we require to improve safety culture across the organisation. 2 of the themes that surfaced today was how good we are as teams in dealing with safety issues for our patients, and overall we have a proactive safety culture within our teams. However, there is some improvement required with our cross-boundary communications when we're talking about patient safety issues that are owned by more than one division. Overall, this has been a very positive exercise. Staff have enjoyed the opportunity to reflect on their patient safety culture, and we will be moving things forward over the next month or two.